And good evening, everybody. Local schools getting ready to start a new academic year amid the pandemic. With the first day of classes some 2 weeks away, local doctors tell News 8 there's another reason to make sure kids follow COVID-19 safety guidelines.
Children could be COVID-19 carriers and no one would know it. All of this just adding to uncertainty tonight. Christian Garzon joins us live now tonight. And Christian, we are talking about a new study. It is getting a lot of attention.
It is. Dr. Emil Lesha with Rochester Regional Health says looking at those recent studies, as you said, kids can be large virus carriers and no one would even know it. He says when it comes to coming back to the classroom, we need to stick with tried and true prevention measures. It's almost time for back to school, and with some of those hybrid and full in-school plans, that'll mean kids gathering together once again.
The bottom line is if schools rely on symptoms alone or just taking a child's temperature, there could be problems with that.
Dr. Emil Lesha says children in particular can carry the infection yet show no symptoms. He says in a recent study from the Journal of Pediatrics, researchers tried to measure the viral load in kids.
And what they found was that early on, when they were the least symptomatic, when they didn't have any symptoms, they had very high levels of the virus.
He says when children are at their most active, most normal selves is when they can be the most infectious. Lesha says that's what's tricky about COVID-19. You can oftentimes be at the most contagious when you're feeling just fine.
That's why it's important for the control measures, to continue to rely on masks and social distancing.
Lesha says we don't have the capacity yet to rapidly test everyone going into a high-density setting like a school. Dr. Stephen Cook with URMC says sticking to what we've learned thus far is key to going back to the classroom.
I think what we have to understand is for our community, our rates are extremely low. We've worked very hard to get here. We're doing the right things, and so I think sticking to that will be really important.
Encourage your child to practice the safe behavior that we encourage. It may be hard for them to wear a mask, but it's important for their safety and the safety of others.
And the doctor reminds everyone, he says, look, kids are more prone than adults to touch everything clean or dirty. And right behind bars, schools and gyms are the biggest places to collect COVID-19 and bring it back. So be careful. From Alexander Park, Christian Garzon, News 8. Adam Marine, back to you in the studio.
All right, Christian, thank you. We've got more on that study, by the way, from the Journal of Pediatrics. If you'd like to read it, head over to this article at rochesterfirst.com.